least one vaccine dose in 70% of American adults by the 4th of July. Even partnering with Anheuser-Busch, offering free beers if the country hits that number. But some states are certainly not currently on track to hit that goal. And joining me now, the governor of one of them, Republican governor of Mississippi, Tate Reeves. Governor Reeves, thanks so much for joining us. As I don't need to tell you, I'm sure Mississippi is dead last in the U.S. right now when it comes to vaccinations. According to your state's data, only 30% of Mississippi residents are fully vaccinated. Fewer than half of adults have received at least one dose. So it does not look like you're going to meet President Biden's goal of 70% of adults at least partially vaccinated by Independence Day. Why is Mississippi so far behind the rest of the country?
Well, first of all, thanks for having me on, Jake. It's always a pleasure to come on and talk to you about these very important issues. Let me begin by saying that I believe that the vaccine works. I believe it's safe. I believe it's effective. I took my first dose in January, as did my wife on TV live, and have encouraged Mississippians to do the same. But I also want to point out, Jake, that what President Biden's goals for July 4th or otherwise are arbitrary, to say the least. But here's the reality. The fact is, for over a year, we tried to focus our goals on reducing hospitalizations, reducing the number of individuals in ICU beds, because we think the most important thing is that if you get the virus, that if you can get better with good quality care, that you receive that quality care. At our peak, we had 1,444 individuals in the hospital. Today, we have 131. We're down 90%. At our peak, we had 2,400 cases per day over a 7-day period. Over the last 7 days, we've had barely 800 cases in total over those 7 days. And so for that entire year period, the goalpost was, let's reduce the number of cases, and we've been successful at doing that. The question is, why have we been successful at doing that? We've had 1 million Mississippians that have gotten the vaccine, but we've also had 320,000 Mississippians that have tested positive for the virus. Many people believe that somewhere between 4 and 5 times more people that have gotten the virus that have not tested have gotten the virus. And so we've got somewhere probably between 1 million or so Mississippians that have natural immunity, and because of that, there is very, very, very little virus in our state.
Right.
But we're still working to get the vaccine distributed and hope we'll continue to do so.
I appreciate that things have gotten safer for Mississippians, and God bless. That's wonderful news. But I guess the concern is what happens when there's another wave, if so many Mississippians are not vaccinated? What if it's one of these new variants? I want you to take a listen to some public health officials issuing a stark warning for states such as yours. Take a listen.
This virus is an opportunist, and that where we have low rates of vaccination are where we may see it again.
They are sitting ducks for the next outbreak of COVID-19, which shouldn't have to happen now.
Are you worried that Mississippians who don't get vaccinated are going to be sitting ducks, as you just heard from the NIH director?
Well, those same public health experts are the exact same individuals that have been advising President Biden, who said in March that we were all Neanderthals because we were willing to open our state up and open our economy up. They were wrong then, and they're wrong now. Now, am I worried? You've heard me say this throughout this pandemic. If the question is, are you concerned with respect to the pandemic, the answer is always yes, no matter what the remaining words in the sentence is or the remaining words in the question. And that's just a fact. We're going to continue to monitor it very closely. But the fact is we're down 98% since early January in terms of total number of cases in our state. We had less than 50 Mississippians in ICU beds with the coronavirus as of Friday. The situation is much different than any of the public health experts warned us. In March, the president came after me personally. And that's okay. I'm fine with that. But the question is the why. Why are we taking the vaccine, Jake? The reason the vaccine is being distributed, and thank God for the Trump administration that we were so quick in getting it done, but the reason it's being distributed is to drive numbers down. And it's happening in our state, and I'm hopeful it's happening in other states as well.
Well, first of all, just as a point of clarification, I think it was Biden himself who used the term Neanderthal thinking, not his health advisors, and that was about not embracing science. I'm not defending the comment, but I think that was a context. Dr. Collins, who you heard from there, the NIH director, was also NIH director during the Trump administration. I guess just the point is, you seem to be arguing two things. You seem to be arguing everybody should get vaccinated, and yet it's not that big a deal that not everybody's getting vaccinated, and those seem to be in conflict. You would argue, you would agree that Mississippians watching right now should go get vaccinated, yes?
I would absolutely agree, Jake. I think that all Mississippians and all Americans should go get vaccinated because I think it's safe, I think it's effective, and I think it's one way to continue to drive down the numbers. But I also, Jake, and this is where I differ from the Biden administration. This is where I differ from you and so many other people.
It's not just about numbers.
Individuals can make their own decision, Jake. Individuals can make their own decision as to how to protect themselves and their families. Government's role here is to make the vaccine available, to make it easily accessible for Americans, to make it easily accessible for Mississippians. We've done that in our state. We've done that in many other states around the country. And now I encourage my fellow Mississippians to go get vaccinated. But that's an individual choice, and we've got to get out of this idea that central government in Washington, D.C. knows best on all decisions, and that's the view of the Biden administration and so many others in the far left.
I'm not really quite sure what you think. I disagree with what you just said. I don't support mandatorily vaccinating people. I just think that you're contradicting yourself. But let's move on because there's a couple other very important issues that have to do with Mississippi. The U.S. Supreme Court is going to hear arguments next term regarding a Mississippi law which bans abortions after 15 weeks, no exceptions for rape or incest. Is it your hope that the Supreme Court will use this law, which you support, as a vehicle for overturning or undermining Roe versus Wade?
Well, Jake, let me just tell you that for people such as myself that are pro-life, I believe that the Supreme Court made a mistake in the 1970s. But that's not the issue at stake that is before the court, hopefully when the arguments are heard sometime in the fall. The question that is before the court, and this is something that you mentioned earlier, and that's with respect to understanding and appreciating and respecting science. The fact is, we know so much more in America today about the formation of young children in the womb than we did when Roe v. Wade was decided in 1973. We know so much more even than we knew when Casey was decided in 1992. That was almost 30 years ago. It is not unusual for the court to review cases from the past. And what we know now, Jake, is that we know that the heart has partially formed at 15 weeks. We know that the baby in the womb is practicing breathing. We know that most internal organs have started to form, and we believe that that child is viable outside the womb. And so the question is not, are you going to overturn Roe v. Wade? The question is, the science has changed, and therefore it makes sense for the court to review their decisions from the past, and this is a vehicle in which for them to do it.
And what do you say to a Mississippian who says, why are you telling a girl who has been raped by her uncle that she has to carry the child to term?
I'm not telling any child in Mississippi anything. What I'm telling everyone is we believe that abortions are murdering literally millions and millions and millions of Americans across many, many years. And it's a sad, sad state of affairs. And we're going to work very hard to make sure that when that baby becomes viable, that it is treated as a human life, because that is exactly what it is.
All right, Governor Tate Reeves, thank you so much. Really appreciate your time today. Hope you enjoy this beautiful June day in Mississippi.